Hi, my name is Karen Bailey and I'm a pelvic health physical therapist. I work at Core Rehabilitation in Santa Maria. A pelvic health physical therapist is a physical therapist who has advanced knowledge and training in treating the pelvic floor internally and externally. Today I'm going to talk to you about some of the common diagnoses that we see in our practice involving pre and postnatal patients. Probably the most common diagnosis that we see is incontinence, which is leakage of urine with activities of daily living or when the urge sets in. Pelvic pain is another really common diagnosis that we see that can involve external muscles around the pelvic floor or internal muscles within the pelvic floor. That also can be caused from scar tissue from C-sections or episiotomies. Common complaints that we may see with some of our pelvic pain are the inability to tolerate intercourse or to wear a tampon. Pelvic organ prolapse is another common diagnosis that we work with that can involve the bladder, the rectum, or the uterus. Diastasis recti is a separation of the abdominal wall. This happens often during pregnancy, and the abdominal muscles do not close correctly and can cause other issues such as low back pain, pelvic floor issues, or breathing issues. General low back pain and SI pain is another diagnosis that we see a lot with pregnancies or after pregnancies. And the next one that we'll discuss is constipation, and we will help patients, learn ways to get their diets correct and ways to relax the muscles if those muscles are really tense due to changes in their body through the cycle of pregnancy.
Sammi Stollberg. I'm a physical therapist and I specialize in the treatment of the pelvic floor. On your first visit, you'll come into our office and check in with our receptionist, Sharky. And you'll notice right away that our office is a little bit quieter and privater than the normal physical therapy office. We don't have a usual gym atmosphere that they have in most outpatient clinics. And that's on purpose. We want people to feel calm and relaxed when they come see us. And then we'll get started. We'll bring you into one of our treatment rooms and have a discussion about what's going on with your issue. And then we'll start the exam. I'll start by looking at your general range of motion through your spine and your hips, similar to what you may have had at a regular physical therapy evaluation. But then we'll get a little more specialized to the pelvic floor. I'll take a look at your abdomen to see how well your abdominal muscles are functioning and if there's any issues with diastasis recti. We may do a palpation of the muscles in your legs and your gluteals to check for any areas of restriction or tightness or pain. And then we can do a palpation on the outside of the pelvic floor and internally in the pelvic floor if indicated. And if you want to, you always have the ability to delay that internal exam, or we can do what we can without the internal exam. And then based on everything we find, we'll come up with a treatment plan. And I like to even start treatment on the first day and give you a few things that you can take home and get started with. And of course, if anyone is going to become a patient, they always have the option to give us a call and discuss what may happen at that first visit if they're still feeling uneasy about it.